Hello, Dr. Sean here. As we get older, even when we go to the doctor for a basic physical, there's always concern about cancer, right? Today, I want to talk about how we can assess the risk of cancer through one particular indicator in our frequently done CBC result, the complete blood count. It's not a foolproof method, but research suggests that when this specific value is high, the risk of cancer increases. So it's something to pay attention to. Now, what is this indicator? Quickly go to the patient's portal and take a look at your blood work. The indicator that you should look for is the platelet count. Platelet count is a value that we can easily find through a blood test. Recent study done by medical school in UK show the relationship between the platelet count and the incidence of cancer. Today, I'll introduce two studies from the same institute, one from 2017 and another one from 2020, with a more detailed study, discussing what values indicate that we should conduct further examination for cancer. If you're curious, please stay until the end. I really appreciate it. If you found this helpful, please hit like and subscribe as well. I will keep the explanation simple and quick. Let's get to it now. We all know what blood plates are, right? They are cell fragments in our body that form clots and prevent bleeding. They play a crucial role in our body. Obviously, having too many or too few isn't good. But the normal range for this count is quite wide. Please remember that the normal range is wide. Researchers from the same medical school conduct a study on the same topic in 2017 and 2020. The results were very interesting and I thought it was worth sharing with you so that way you could also check the number from your own result. To cut the chase, exceeding the platelet range correlate with increased risk of cancer. The first study published in June 2017 in British Journal of General Practice was conducted by targeting 40,000 individuals with platelet counts exceeding 400,000. They also analyzed the medical records of 10,000 individuals with normal platelet counts to measure the relationship between cancer incidence and platelet counts. The study aimed to examine how the rate of cancer diagnosed within a year varied based on the platelet counts level. For men, the study found that individuals with normal platelet counts had a cancer diagnosis rate of approximately 4.1% within a year. In contrast, those with platelet counts exceeding 400,000 had a significantly higher rate, reaching 11.6%, indicating 3 times higher. As for women, the results show that those with the normal platelet counts had a cancer diagnosis rate of 2.2% within a year. However, those with the platelet counts exceeding 400,000, the rate increased to 6.2%, representing again 3 times increase. Additionally, the platelet count can fluctuate between the first test and second one, right? However, cases with consistently high counts after 6 months show an even higher incidence of cancer. Women experienced a significant 10.1% increase in cancer diagnosis rate, while men had a more severe increase of up to 18.1%. This data indicates that consistently elevated platelet counts correlated with increased cancer incidence. The second study, published in 2020, provided more detailed analysis. While the first study compared the count exceeding 400,000 with the normal range, the second study further categorized the normal range into the four groups. The first group was defined as a lower normal range, ranging from 150,000 to 325,000. The second group is counted from 326,000 to 350,000. The third group includes counts from 351,000 to 375,000. Finally, the fourth group, the highest normal range, from 376,000 to 400,000. The study involved 295,312 participants. The researchers compared the risk of cancer incidence among different groups of people based on their platelet counts. They used the first group, which had a lower normal platelet counts, as a reference point with a relative risk of 1. Then they examined how much the overall risk of cancer increased across the various platelet counts group within the sample. The result indicate that in the second group, the relative risk was 1.36, representing 36% increase. In the third group, it was about 56%. And in the fourth group, it reached 63%. The study also found that for men over the age of 60, there was a clear increase in the incidence of cancer in the second, third, and fourth group compared to the first group, with an approximate increase of 4.2%. And men over 80, this increase was particularly pronounced, especially in the fourth group, where the risk increased by up to 6.7%. On the other hand, the study suggests that there was a slight increase of less than 3% for women, indicating no significant difference in risk among the various platelet count groups. For women, the study doesn't show any significant relevance, but if you're a male individual over 60 who are categorized within the second, third, or fourth group, it is strongly recommended that you go for more precise cancer screening. The study particularly highlights three closely related cancers. First is a lung cancer, second is a colon cancer, and third is a rectal cancer. While it's important to note that the participants in the study were from the UK, and there might be some differences when compared to the US population, the key findings suggest a strong association with the lung cancer, colon cancer, and rectal cancer. Today, I share how we can predict the risk of a cancer through the easily accessible CBC test. If your CBC results show that your counts are within the normal range, that's indeed fortunate. However, if it exceeded 400,000, please pay attention to your body signal, and I strongly advise you to undergo through examination. Secondly, even if your results fall within the normal range, if you are a male over 60 and categorized under the higher normal group, I recommend undergoing comprehensive testing for early detection. I encourage everyone to do regular checkups and maintain healthy lifestyle. In the next video, I'll be sharing 5 signals related to lung health. If you're a smoker, this will be very important, and if you're not, it'll be still worth watching. So please don't forget to like and subscribe. Until next time, stay healthy.